It's been I guess a recent Canadian meeting, a meeting of the Canadian delegation. Are health and health system issues being talked about much in that sort of context?
It's really new, I think, for a lot of policymakers to think through these lenses. From our perspective, it's really important because it really connects individuals to the climate policies in a way that talking about polar bears or frogs can never do. And so I think the policymakers are starting to recognize that frame is really useful in getting the public on board.
Can I take you back to COP26, Courtney, in particular, where this commitment was made by Canada to deliver a climate resilient, low carbon, sustainable health system? It was really important, I think, in many ways, that federal commitment. And I'm wondering in what ways that set of questions is being raised again here at COP27. What kind of conversations are happening around that commitment?
It's been very important internationally. The WHO now has over 60 countries signed up to that. And so yesterday they held a panel around the ATTACH system, which is a secretariat that the National Health Service and the WHO are partnering on to really make sure that we have a way of spreading and scaling best practices. So we know that the NHS in England is way ahead, really, of anybody else. They've got incredible evidence-based plans produced by the Lancet. They've got 10 years worth of data leading up to this last commitment. They've got 150 people working under them. They're central to the actual administration of the entire health system. So it's a gift, really, to the rest of us that they're willing to help us accelerate. And so there was a panel yesterday where John Daldas from the US was talking about how they're going with they're partnering with the White House to make a sign-on system at the hospital level, because of course they have a lot of private hospitals there, so it's a bit different to administer. At the the public hospitals that they do administer, they're starting a program to make sure that they're an integral part of helping the government meet their greenhouse gas goals. They've got a toolkit that they're producing for both low carbon health systems and really resilience, because we know that this is partly about decarbonizing, but it's partly about supply chains. It's partly about infrastructure. It's partly about making sure we have electricity supplies for our hospitals that can withstand extreme heat. So the resilience part of it, the adaptation part of it, I believe that's probably what drives me as much as anything. I have worked in humanitarian circumstances with Doctors Without Borders where we ran out of supplies. And if you've ever been in the situation where you have somebody dying under your care and you know you could save them if you just had the right tools, and that tool is not on the shelf, that's the type of provider trauma, really. Those tragedies you can't shake. Mm-hmm. And those memories and the recent supply chain disruptions that we've had with normal saline, with anesthetic drugs and pain medication, with amoxicillin, Tylenol. I mean, our entire pharmaceutical supply system doesn't work, and neither does the internet.